These people are not zombies, nor are they actors in a movie. They are young men and women who are in a state between life and death. They have taken a drug that has left them unable to stand or sit, unaware of what is happening around them, and completely unconscious. Anyone who becomes addicted to this drug does not find it easy to quit. Instead, they face an extremely dangerous phase. This drug is made from medication, originally intended for use on cattle and horses. A single injection can cost you your life, and in recent months it has spread rapidly across the streets and neighborhoods of the United States, before recently reaching countries such as the United Kingdom and Canada. In the past year alone, 107,000 people have died from this drug in the United States. So, what is this drug? What is it made of? This new drug, which has spread excessively in recent months across countries including the United States, the United Kingdom, Canada, and parts of Europe, is known as xylazine or tranquilizine. Xylazine is an injectable painkiller, originally designed for large animals such as cattle and horses. It is not intended for use by humans. This injection is mixed with one of the most dangerous drugs known as fentanyl. Fentanyl is a synthetic drug that is 50 times more powerful than heroin. When xylazine is mixed with fentanyl, it produces a drug known as the zombie drug, which is what we see affecting the people in these images. It turns them into individuals suspended between life and death. A person who takes this drug remains in a state between death and life while it is in their body, unable to move and completely unconscious. Use of this injection causes severe symptoms, including difficulty breathing, a drop in heart rate, and temporary stoppage of blood flow to certain parts of the body. When fentanyl is mixed with xylazine, the duration that the drug stays in the body is significantly increased. There are two methods of use: sniffing it through the nose or injecting it directly into the body. At the injection sites, small wounds develop that later turn into severe, rotting ulcers that cannot be treated. Eventually, this leads to the amputation of the entire limb to prevent the damage from spreading to the rest of the body. This drug is not new. It was first used in the early 20th century and originated on the island of Puerto Rico. However, it was not widely used until around 2020, when it began spreading rapidly across U.S. drug markets. Between 2020 and 2021, it was estimated that nearly 70,000 people died from this drug. What truly shocked the world was that in 2022 alone, 107,000 Americans died due to this drug. This forced the U.S. government to recognize the extreme danger posed by this substance. On April 10th of this year, the U.S. government officially classified this drug as a serious public health security threat, stating that deaths linked to it had increased by 500% over the past year. Xylazine has now crossed U.S. borders and spread to countries such as Canada, the United Kingdom, and parts of Europe, including Germany. Its impact continues to grow due to the ease with which it can be purchased. In the United States, medications intended for animals can often be ordered and bought online. Since this drug is originally a veterinary medicine, many addicts can easily purchase these injections online at very low prices. The use of medications as drugs has become increasingly common in recent years, replacing the use of dangerous substances such as heroin and cocaine. As a result, medicines, especially those misused as drugs, have become even more dangerous than the traditional drugs that were previously known. In Somalia, many young people have for some time been using as a drug the medicine known as question left incomplete in original text.